Hello guys, welcome to my YouTube channel. It's me Sujit and today I'm going to explain completely on COVID-19. So let's begin. What is coronavirus? According to the World Health Organization WHO, coronavirus are a family of viruses. They are found in many different species of animals including camel, cattle, cats and bats. Animal coronavirus can infect people and spread through people. In recent years, there has been outbreak of an animal coronavirus that has infected humans, such as the Middle East Respiratory Syndrome and Severe Acute Respiratory Syndrome (SARS-CoV) and MERS-CoV, which cause illness ranging from common cold, diarrhea, and more severe illness. In December 2019, the first diagnosis of novel coronavirus COVID-19 was made. Novel coronavirus COVID-19 is a new strain that has not been previously identified in humans. Where did coronavirus come from? The exact source of coronavirus has not been confirmed. However, the outbreak originated from Wuhan, China. Genetic codes or the genetic analysis of coronavirus match two bat viruses. Genetic analysis also indicate that the genetic building blocks of novel coronavirus closely resemble that of snakes, specifically the Chinese cobra. Experts suggest that a population of bats could have infected snakes which passed the virus on to humans. How is the coronavirus transmitted? Coronavirus or COVID-19 is often spread from human to human. The virus spread or transmitted similarly to influenza, the way which it is transferred or any other respiratory pathogen spreads. When an infected person coughs or sneezes, respiratory droplets are produced. These droplets may land into the mouths or noses of people who are nearby. It can then be inhaled into the lungs of a human body. It is currently regarding respiratory virus, people are thought to be most contagious when the infection is at its peak. With COVID-19, however, there has been reports of spread from an infected patient with no symptoms to close contact. Can coronavirus be spread by animals? Coronavirus are zoonotic, meaning that they can be spread between animals and people. Detailed investigations found that SARS-CoV was transmitted from civet cats to humans and MERS-CoV from dromedary camels to humans. Several known coronaviruses are circulating in animals that are not yet infected humans. How do you test for coronavirus? Testing for coronavirus is done by collecting specimen samples and having them tested for the virus. The time frame of retrieving the specimen and having it tested is vital, as well as the storage temperature and the method of specimen sampling. Samples include nasopharyngeal or oropharyngeal extracts, bronchial alveolar lavage, pharyngeal aspirates and sputum. Swab specimens should be collected only on swabs with a synthetic tip. Specimens can be stored at 4 degrees up to 72 hours after collection. Is coronavirus a new virus? Coronavirus were first identified in 1960s. However, it is unknown where it originated from. The name coronavirus comes from its crown-like shape. It has a crown shape which then attacks on the cells of human body. The virus can affect both humans and animals. Everyone has a coronavirus infection at least once in their life, most common during childhood in winter. 2019 novel coronavirus COVID-19 is a new type of coronavirus which was identified by WHO since the outbreak in China in December 2019. Common symptoms of coronavirus. The symptoms of most coronavirus are like any other upper respiratory infection, include stuffy or runny nose, sore throat, coughing, shortness of breath, headache and a fever. In most cases, you wouldn't know whether you have a coronavirus or a different causing virus, such as rhinovirus, which is easily treated with over-the-counter medication. In most severe cases, coronavirus can cause pneumonia, severe acute respiratory syndrome, kidney failure and even death. The coronavirus can also cause middle ear infections in children. Is there any more than one type of coronavirus? There are many types of coronavirus. Most coronavirus are not dangerous, however some are serious. In 2012, 858 people died from MERS, which first appeared in Saudi Arabia and spread to Middle East, Africa, Asia, Europe and America. In May 2015, there was an outbreak of MERS in Korea, which was the largest outbreak outside the Arabian Peninsula. In 2013, 774 people died from SARS. However, there have been no reported cases of SARS of 2015. How long does coronavirus live? The incubation period is up to 2 weeks, which enables from the virus to spread through person-to-person contact. Symptoms of novel coronavirus COVID-19 may appear in few as 2 days or as long as 14 days. Ranges vary from 2 to 10 days, 2 to 14 days, and 10 to 14 days, during which the virus is contagious but the patient does not display any symptoms. The virus has been reported in 25 countries as of January 2020. How can I protect myself against coronavirus? There are many precautions that can be taken to avoid contacting coronavirus. Wash your hands often with soap and water for a minimum of 20 seconds. Use an alcohol-based hand sanitizer that contains at least 60% of alcohol if soap and water is not available. Stay home when you are sick. Cover your cough or sneeze with a tissue and then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. Avoid close contact with anyone showing symptoms of respiratory illness such as coughing or sneezing. Avoid animals, alive or dead, animal markets, and products that come from animals such as uncooked meats, etc. Healthcare facilities should enhance standard infection prevention practices in hospitals, especially in emergency departments. Health experts have advised that only a reusable N95 respirator mask certified by an impartial agency can shield against the virus and protect others too. Paper or polyurethane foam mask does not filter out particles responsible for spreading infectious agents. The WHO does not recommend any specific health measures for travelers. In case of symptoms suggestive of respiratory illness either during or after travel, travelers are encouraged to seek medical attention and share their travel history. What are the medicines that can help us from coronavirus? There is no specific medicine that can help us from coronavirus, but there are some immunity boosters and some medicines that can help our body to kill coronaviruses. So I'm going to suggest you to use vitamin C, the tablets, which have 20 tablets. You have to use one a day. It's a kind of aspirin tablet. You have to dip it in water. Till the tablet gets completely dissolved. Even multivitamin is also same, and it contains so many vitamins which can help your body to get more immunity. And I also suggest you to use betadine mouthwash and gargle. It kills bacteria, viruses, and fungus in your throat. You have to dilute this medicine in 2/3 of water, like quarter of betadine syrup plus 2/3 of water. You have to dissolve it, and you have to gargle your water, and also use cotton buds if you want. Dip them inside the dilute solution and put it inside your nose so that it gets so the coronavirus dies. So please stay safe and stay at home. Help small children and old people and encourage them to not go out, and help them to stay at home and not getting coronavirus, because the most percentage is in small children and old people, because they have very less immunity in them. So thank you. If you like the video, please like, share and subscribe.